Kentucky can create a brighter future for our children. That effort requires all of us in many different types of solutions, including state policy change. The Blueprint for Kentucky's Children is a coalition of nonprofit, public, and private organizations that speaks with a common voice to advocate for state policies that can create the future we all want to see for Kentucky's kids. The Blueprint stands on 3 pillars. Thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. Each year, the coalition creates a shared agenda of policy and budget priorities to present to the Kentucky General Assembly. The 2020 Blueprint for Kentucky's Children agenda includes the following proposals to help improve the outcomes of kids and families across the Commonwealth. Children thrive when their parents can earn a living and meet their family's basic needs. According to Kids Count data, nearly half of Kentucky kids live in low-income families. A state-level refundable earned income tax credit is a proven approach to help low-income families keep the money they earn while reinvesting those dollars into their local economy. We also know that when families have access to high-quality, reliable childcare, parents can get and keep a job, children are set up for success in school, and families and local economies can thrive. As Kentucky promotes workforce development, the Commonwealth must also increase child care assistance to support employed parents who are struggling to make ends meet. All children, no matter where they live or receive child care, deserve healthy food and time for active play. Kentucky can strengthen licensed child care program standards on healthy eating and drinking, active play, and screen time to support children's healthy growth and development. When it comes to children's health coverage, Kentucky has made strides with 96% of children having insurance. Kentucky can continue to prioritize Medicaid and the Kentucky Children's Health Insurance Program in the state budget. By investing in initiatives focused on closing the remaining gap in coverage, children can access preventative services and receive care when they are sick. We must also continue to ensure that any changes to the Medicaid program are simple for families to understand, participate in, and utilize. Another child health-related topic that has dominated headlines recently is the epidemic of e-cigarette use among Kentucky kids and teens. These battery-operated tobacco products contain highly addictive nicotine and other harmful chemicals and particles that can have immediate and lasting damage on kids' growth and development. Kentucky can protect kids' health by enacting a tax on e-cigarettes equivalent to the current tax on cigarettes, raise the minimum legal sale age for all tobacco products, and boost state investments in tobacco use prevention and cessation programming. One area of student health that has been prioritized by state leaders recently is behavioral health. In 2019, the Kentucky General Assembly demonstrated their commitment to student safety by passing the School Safety and Resiliency Act. Kentucky can continue improving school safety and promote student health and well-being by providing funding for trainings and physical safety improvements required within the Act, promoting expanded school-based behavioral health services, and investing in critical resources for students such as family resource and youth service centers. While school districts across the Commonwealth are shifting their focus to how to best serve children who've experienced trauma, several districts still allow the use of corporal punishment or physical force as a form of discipline. For children in schools that use corporal punishment, the classroom can become an environment that instills fear, anxiety, and distrust. Kentucky can eliminate the use of corporal punishment in schools to create the best learning environments for students. Kentucky can also ensure the safety and success of students by strengthening the process to enroll and homeschool. In most cases, parents choose to homeschool based on the needs of the child or their family beliefs. Sometimes there are circumstances where parents or caregivers choose to avoid the oversight of a school or child protective services because of allegations of child abuse or neglect or ongoing issues of their child's truancy. Kentucky can ensure that all kids who are entering the homeschool setting are safe and receive the education they deserve. Too many Kentucky children are victims of child abuse or neglect each year. While Kentucky has made strides to improve the foster care system for children who have experienced abuse or neglect, more can be done to prevent maltreatment and strengthen families. Kentucky can strengthen efforts in child abuse and neglect prevention by investing in programs that keep kids safe and families together, such as the Sobriety Treatment and Recovery Team and HANDS Home Visiting Program. Kentucky can also make common sense changes to state policy that would protect kids and help kids who have experienced maltreatment heal. Kentucky can prioritize investments for children who have experienced abuse and neglect by strengthening supports for relative and fictive kin caregivers. When children cannot remain safely with their parents, grandparents, other relatives, and close family friends often step up to help raise them, usually without notice or preparation. Kentucky can increase the amount and availability of a one-time financial support when the child is placed with the caregiver and provide access to safe, affordable respite care options, a resource that is already available to foster families. Kinship caregivers sometimes step up when a child's parent is incarcerated. In Kentucky, 13% of children have had a parent separated from them due to incarceration, and it has been referred to as a shared sentence due to the short and long-term effects it has on children's physical health, mental health, and educational achievement. Children experiencing parental incarceration need a system of justice that will hold their parents accountable and reserve incarceration for those who pose a risk or threat to public safety. Kentucky can limit the use of cash bail for people who commit low-level or nonviolent crimes to allow parents to continue to work and care for their children. Kentucky can also address the addiction crisis and its impact on families, the foster care system, and criminal justice system by utilizing state funds to establish family recovery court pilot projects in select Kentucky communities. In the youth justice system, Kentucky is leading the way in reforms in so many ways, but our state has been stuck in a single gear when it comes to automatically transferring youth to adult court for certain offenses. Kentucky can use the right gear for the right situation by expanding court discretion and eliminating the automatic transfer of youth age 14 and older to adult court for situations involving a firearm. Keeping children who get in trouble within the youth justice system when appropriate means more cost-effective and developmentally appropriate responses. We can continue progress with youth justice system reforms and ensure safer communities and brighter futures for kids by addressing the root cause of a child's behavior. Currently, the youth justice system operates like a complex maze with many points of entry, making it easy to get in but very difficult to get out. Kentucky can establish a minimum age that a child can be charged with an offense and connect the child to family-focused services to prevent children from entering the maze of the youth justice system. Kentucky lawmakers have several opportunities in the 2020 legislative session to make policy decisions and budget investments in the best interest of kids. As a shared voice, we can achieve so much for kids. Are you ready to take action? Visit kyyouth.org/policy to find out who your state legislators are, learn more about the Blueprint for Kentucky's Children Priorities, follow action alerts, and track the progress of bills that are good for kids.